Welcome back, everybody. Running into our last session before we do our conclusion. So I'm delighted that we'll have a panel discussion with some really interesting speakers. And let me hand back, I should say, to Nigel to facilitate this session. So the panel discussion will be on how can we further strengthen emergency health and nutrition responses in fragile contexts. And Nigel will moderate it. Over to you, Nigel.
Many thanks, Conal. So this is the last formal session of a fantastic day, so feeling a bit of the pressure. I particularly enjoy this discussion. It's been great to hear the passion in the group work for finding new routes to greater impact. And wonderful for me to be transported back to Niger and meet the Secretary General Abdoulaye. To hear about the collaborations with the Ministry of Health in particular, and to see a program that's producing such wonderful data, data that really helps with learning and accountability, and within that data to see such great results around the reach and the impact of the early action. So, really wonderful presentations and discussions so far. So thanks very much. As you say, this topic is the final session of bringing together a panel of experts to discuss what can and should be done to tackle the critical challenges of responding to health and nutrition crises in the world's most fragile countries, taking into account a shifting global context and ever-increasing humanitarian needs. And we're doing this through the perspective of the PPP. Before I introduce the panelists, I just want to remind everyone, please do put your questions in the chat box. Of course, if you don't feel comfortable with that, you can also put up your hand. What would be great this time around is if you do have a question or your name is called out to ask your question, do put your camera on. We'd love to see you, just to make it that little bit more personal when we get to that point. We're going to hear from the panelists, and then at the end, we'll have 15 minutes for questions and answers. And so we do have time, as before, for those questions. So please don't be afraid to put them in. Don't wait till the end. As soon as you've got a question, pop it in the chat box and we will get to it. So if you'll allow me, I'll introduce our panelists. I hope the cameras are on them. I'm going to start with Amina Ibrahim Abdullah. Amina is Concern's Regional Director for the Horn of Africa. She has over 2 decades of experience in the field of community development and food security in the region. She's overseen the growth and consolidation of Concern's work on food security and social protection in Kenya, and Concern's engagement in preparations towards the UN Food Systems Summit. We have Christian Ruder. Since 2020, Christian has worked as Regional Nutrition Advisor for UNICEF Eastern and Southern Africa Regional Office in Nairobi, providing technical and strategic support to the 21 countries in this huge and important region on addressing all forms of malnutrition and emergency nutrition response. So welcome, Christian. Lastly, Sophie. Sophie has 20 years experience of working in nutrition. And since 2014, she has been working as a thematic expert in nutrition for the European Commission's Humanitarian Aid and Civil Protection, DG ECHO. She too is based in Nairobi and provides technical support to operations in the Eastern and Southern African region as well. So welcome to all the panel members. Before we start, maybe having introduced you, you'd also like to just say a little bit about yourselves. And just to, if I can ask you all just to speak for a minute or two about your experience with PPPs and the perspective that you bring to this discussion. And Amina, I'll start with you.
Thanks, Nigel. I think in terms of my role and interaction with the PPP, I oversee 3 out of the 5 countries where Concern implemented the PPP model. And just listening to, I mean, I've had very close interaction with the programs in the various countries, but just listening to the presentations today, you can see the ambition of the program. It sought to apply a model over 5 countries that are similar in some ways, but very different in other ways. And it called for agility in the implementation, which the funding instrument provided for. The other takeaway is, the showcasing of the importance of an integrated approach to addressing malnutrition in this context. It is complex, integration is complex, but it can be done. And it is doable if the response is as localized as possible, and that the layering is done in a way that makes sense. So I would say those are my two takeaways from the day, but looking forward to the discussions within the session.
Thanks, Amina. Over to you, Christiane.
Okay, good afternoon, everybody. And I've really enjoyed listening to quite a lot of the session today and really thinking how we can connect all this really valuable learning from the local level, from those different contexts with, and bringing them to, national level, to bring them to scale, to bring them to policies, to bring them into strengthening the overall systems. So on the PPP, so UNICEF is SARO, supporting 3 key countries, and 2 of them were discussed also today. So Ethiopia, Somalia, and South Sudan has a PPP that it's a single contract with ISARO, my office, and I'm the focal point for it, together with my team. It started in March 21, runs for 3 years. The original value was around 48 million, but top-ups from the HIP stream were added for the countries. And all 3 countries focused on the same objectives with the same indicators. So again, you can already see that this really brought, the common key aim. The focus was on treatment and obviously accelerating treatment. We did not at the time of signing quite see yet how severe the drought would be and how severe the crises in the country. So I think it did really achieve its objectives of scaling up treatment, but also had system strengthening objectives to continue to pursue and document simplified approaches, focus on supply chain strengthening, supply maturity, reducing stockouts, and at least for Ethiopia, try to begin to get progressive national financing. So I think all of those objectives were on track, and the facility was very much appreciated for the learning, the interaction, and the 3-year horizon of the PP.
Great, thank you very much. Last but not least, Sophie.
Thank you. Good afternoon, everyone. So yeah, for my role, I've been lucky to be the field focal point for these 2 PPPs. So the one with concern, ERNE, in the 5 countries we have talked about today, and also the one with UNICEF on the 3 countries that Chris just mentioned right now. So it was very interesting because of course there was an ambition in both about operational objectives, but also to learn from this modality and to see how we can indeed shape a little bit the contractually speaking within ECHO to be able to better support the need of the partners when it's about addressing needs on the ground. So that was a very interesting experience, and I'm happy that to see that today we are here and talking about all this huge amount of experience that has been really collected and generated with concern. So that's great. Thank you.
Well, thank you, and welcome again to all 3 of you. It's fantastic to have these different perspectives of working within a similar framework. And so now we'll get into some of the questions for the panel. And my first question is, ERNE was supported under a pilot program partnership, a PPP, between ECHO and Concern, which aimed to increase the efficiency and the effectiveness of humanitarian aid. UNICEF is also a PPP partner with ECHO. From your perspective, what are the key benefits of this type of partnership, and how is the learning from this pilot phase being brought into the HIPs at country level? And Sophie, that's for you.
Yeah, thank you. So yeah, I think we have really these 3 years with these 2 different PPPs were really very interesting in documenting, what would be the consequences of having a multi-year and multi-country contract. So I think now we can really see what was the benefit. Definitely, I think there are two main layers from a strategic perspective first, because I think what differentiate the PP programmatic partnership for ECHO from I would say a regular annual project is also that we want to have a strategic element, a strategic added value that will be coming, that will complete a little bit the outcomes that we expect from an operational perspective. And on 3 years, we could see that although, yeah, we wish we had longer, especially because on the implementation of ERNE, we had a lot, of course, of unexpected issues, of course, the COVID, and as it was mentioned today, we had, the floods in South Sudan that have delayed considerably the response, but also, of course, the conflict in Ethiopia, etc. But 3 years really allowed us to think about what can be done and how can we strategize better and implement, conceptualize and implement models that would have a greater impact than just, I would say, the daily operation that we usually do in terms of nutrition and in terms of, if I take the example of the early warning of the action program cash distribution. So just to have this concept to test out the surge approach in the health system, the health surge also in some of the countries, and to have this model where we would indeed try to prepare for crisis and to address rapidly the shocks that were met by the communities. I think that allowed to generate a lot of learning, and I think the presentation just earlier by Jackie and Lucy was really interesting, because there is a lot of learnings, and that is only possible if we do that on a several year planning. We can on a yearly planning we wouldn't have had a chance to really see that and to generate all that learning. From an operational side, I think what was very interesting is that because we had all these unexpected events and we had to change the plans, unfortunately, I think it was, as it was said, we couldn't necessarily implement the actions as it was initially thought. We had to adapt and concern. They were really good. The teams on the ground were really put to the test and had to adapt and to make do and be relevant to the new needs that were rising through drought shocks, floods, conflicts. And the PP really gave that flexibility as well. So it was just a matter of basically of an exchange of email to say, look, I think this result might not be achievable, at least for this year. We might shift the resources that were planned for the early warning of reaction results to a rapid response result. And it was extremely easy then for us to say, yes, okay, let's go. So I think indeed that was very beneficial for the implementation and for the routine of the operation themselves, this flexibility. So now, how did we learn and how did this pilot experience help shape what is actually ongoing? So now, as you know, we have launched in the HIP 2023 for ECHO, the programmatic partnership. So yeah, I think we had a lot of learning experience. I think every year we had a high level dialogue between ECHO and the partner agencies that were benefiting from these PPs. We also had learning events where we really try to see both at operational level, administration level, financial level, what makes sense, what was not really great, and how we could then improve a bit the model to make it more relevant to our administrative constraints and the partners also needs of flexibility and of understanding. So yeah, all these lessons I think were really taken into account in the model we are, in the way we are rolling that now in the HIPs. So basically, I think the main change is that it's no longer money or budget that are agreed upon, I would say ahead of the HIP period. So now the programmatic partnership are part of the HIPs, partners have to propose in their project whether they would like to have a programmatic partnership or not, whether they want it to be multi-country or multi-year. I mean, there is a lot of flexibility here, and the decision making at eco level is very, very similar, basically, to the one of the FEED process. So it became kind of a program or a mode contract like another one. But we are still learning. I think this year we will certainly take stock also of their experience on the rollout of this first, rollout of the programmatic partnership as a regular type of modality for ECO, and we will certainly adapt. But I think, do not hesitate to challenge us, to discuss. We organize very often some partners consultation at country level. And I think it's very interesting also to have your feedback, because I think the idea is really to make a tool that is in support of the partners. And that's the main objective. Thank you very much.
Great, thank you so much, Sophie. Amina, you were put under pressure and had to be flexible. Have you got anything to add to that?
Well, I think I agree with Sophie's observations on the benefit of the PPP partnership. I mean, from an operational point of view, it has enabled us to consolidate both technical and management capacities at the local level where we're working with MOH. And that, of course, is only possible if you have a continued engagement over a number of years. We all know the challenges of, short-term, 12-month, 18-month programming, and what that does to capacities, not just for NGOs, but also for the counterpart Ministry of Health. It helped strengthen relationship with the communities and allowed us to pilot the tools that were used in the program. That can only happen over a long period of time. Then the flexibility to pivot responses that was encompassed in the model. A good example is in Ethiopia, how, with the conflict, how we were able to quickly pivot towards scaling up the rapid response component of that program and address the needs of the displaced population as a result of the conflict. Obviously, there are administrative efficiencies within the framework. The fact that we're not applying for HIP every year over that period of time. Reporting is consolidated across the five countries. And so we were able to focus the technical support where it was needed, as opposed to getting into this cycle of applying and before you know it, you're winding up a project. And then obviously from the results, seeing that indeed an integrated approach is possible and it is an effective way of delivering a nutrition emergency response because of the multifaceted nature of the drivers of malnutrition in this context. So I leave it there for someone else to come in.
And that someone else is you, Christiane. Do you see anything that's quite different or stands out in your experience?
I think Amina has said it all, and I just echo that. We also appreciated the efficiency of having one contract, the predictability, the flexibility. Those are all things that are often missing in humanitarian response. It's a bit of like, you struggle to get the funds, to get them timely, and then there's a big surge of funds. But having these multi-year kind of arrangements really will help going forward. So we really hope that they become the norm, and that that they will be the standard that are used in these fragile contexts, what we call the no time to waste, chronically protracted fragile contexts. We see a strong need for them to be the norm, a sort of modality, and with more donors coming on board, that would be amazing.
Wonderful, thank you, everyone. We're now going to move to the second question. Second question is, while Concern was able to reach more than 1.2 million people through the ERNE program and build some capacity in the health system, much more needs to be done in a fragile context to build capacity for nutrition services within the health system, as well as ensuring more shock responsive approaches. What policy decisions are needed to strengthen this approach?
I think that's for me, right?
Sorry, Christian, that's for you. Sorry.
Okay, so just to start, from the outset to say that we know that the health system looks very different in different places and looks very different within countries. And some of the countries like Ethiopia or Kenya, which have more kind of evolved and better structured and organized health systems, also have areas of sort of very few and far between and sort of deep structural neglect of certain parts of the country, like Kenya's Asal and Ethiopia's Afar, Somali. And then, of course, you have health systems that functioned really well and had excellent, staffing, supply management, information, and then were very quickly destroyed, like Tigray. And of course, climate-related shocks can also have that effect, but the sort of impact of conflict and insecurity on the health system and its resilience is difficult to manage. So strengthening health systems looks very different. And trying to build up across the 6 building blocks, which is a really important endeavor for us also, and to make some of the good practice to become standard at the national level. Of course, taking account of context is something really important. So having, in the governance and policy building block, having, for example, effective coordination and between the different levels of the health system, but also between the health system and other essential multi-sectoral actors like social protection, food system. You alluded to that in some of the presentations. Having policies on staffing and having strong systems for managing and supporting staff at all levels, including community. We see much more resilient and shock responsive health systems where you have this structure all the way to the community. You have health workers that can be moved. It was great to hear about the surge, and we saw it very much, of course, in Kenya, where you have the clear structure of outreach. And again, it's a policy to move people. They can be moved and they go and support the expanded outreach. So those are also elements of the system that can be strengthened and can be made possible at national level. Supply, of course, is another key sort of policy aspect, and we talked a lot today about making sure supplies are available, they're pre-positioned. Putting nutrition supplies on the essential medicines list was one of the objectives of our PPP, and we see varied progress. Getting governments to pay for nutrition supplies. Now, we didn't expect in our PPP that Somalia or South Sudan would do that, but we achieved the target of Ethiopia doing it, which was great. And they have a commitment to continue to do that. It's also Kenya has started, and a number of other countries have started to do that. And we're trying to facilitate that with the match fund for our UTF, as well as a broader nutrition fund. Making the supply chain maturity findings and recommendations also to become part, a standard for the whole system. So each country did a supply chain maturity assessment, making those, what is recommended to strengthen the supply system also standard. And I saw in one of the presentations today that there was concern about unaligned supply kind of management, different partners doing different things. And of course, in South Sudan and Somalia, where the government is mostly kind of absent, it means that we, the stakeholders of all types, UN agencies, international NGOs, and really strengthening the capacity of national NGOs to support whatever fledgling government system there may be. And we really see the role of international NGOs to mentor the local ones, build their capacities where there is no real functioning government system, but then also to progressively shift from doing parallel initiatives to strengthening a whole province, a whole, district by district, a whole province, so that we have this capacity for routine services, for seasonal peaks and for shocks in place.
Excellent, thank you very much. Sophie, any kind of reflections on that and your thoughts?
Thank you. No, I think, yeah, you covered a lot. I think indeed the what we see, I think, is the first thing is every country is very different in terms of capacity, in terms of risks, in terms of needs, and yeah, looking at what can be done indeed to make to prepare better for shocks. Well, it really will require a strong analysis and a strong understanding of how that works. Indeed, I think what we have seen and the crises that we have seen in the past few years have kind of pushed us also to be a bit innovative and to think beyond the box. Is, well, as Chris mentioned, having, you know, some outreach capacity. We see these models in some countries, the ICCM and ICCM Plus, for instance, when it's about providing some treatment at community level, because we see that you know, there is an access issue or distance issue. Providing or you know, in other countries we have had also these mobile clinics that are deployed when we see that you know, there is really an increase in the cases of admission, and we need to get to the people before you know, they come and the children might be you know, in a very late deterioration of nutrition status. So yeah, I think we have a panel, a toolkit of different options. Definitely the surge approach is there, and I really think it's really a tool that we have to continue exploring and adapting and promoting, because especially as we see the magnitude, number and the magnitude of the crisis, especially in our region. I think we're just looking at Eastern Africa, it's and when it rains, it pours. So we have also to be really able to adapt our way of working and have this flexibility for an optimized use of resources.
Thank you. And Amina, any different perspective or something to add?
I agree with what Christian and Sophie have had to say about this, and the fact that we have a basket of tools that we can deploy in different contexts. But I think what I would want to emphasize is the importance of the localized early warning systems and the activation or the analysis at local level and activation of the required or appropriate response. I mean, if we look at the drought in the Horn of Africa, I know we're talking about a specific program, but if I draw upon the drought in the Horn of Africa, we were seeing, you know, deteriorating situation in some communities or at local level. But when you're doing your analysis at meso or subnational level, you never meet the threshold. And so triggering a response at that level becomes a little bit of a challenge, because then resources are not allocated, especially in context of, you know, your South Sudans, your Somalias, your, where government at local level does not have resources to activate any kind of response. So bringing the analysis down to the local level, I think it will be a huge shift or game changer in addressing malnutrition.
Excellent, thank you. I'm going to ask one more question, perhaps in the interest of time, if we can keep the answers short as possible, not as short as possible, but short or clipped. And this question is for you, Amina. With an increasing gap in humanitarian needs and available funding, which has been covered a couple of times in this meeting, in the country programs you're supporting as concerned regional director, how can donors and UN bodies leverage NGO support and improve efficiencies in the response to ongoing crises, particularly Sudan? And Amina, as an NGO representative, can you kick us off?
Well, if we look at the case of the Sudan crisis, I think we can all agree that it has all the ingredients of being a protracted crisis. And as we go into the response, whether it's from an NGO perspective, donor, UN perspective, I think we need to go into it with that in mind in terms of how we design the response, but also the resources we look to mobilize. That said, in order to improve efficiencies in ongoing responses and leverage NGO support, where I think donors and the UN can help most is to look into the governance piece of health system strengthening. I think as NGOs, we're very good at working at the local level, delivering the services and making sure that the most vulnerable are reached. But there are pieces at, higher up that we are not and often don't have the capacity to engage in. And this is around human resource planning, financing for health services, and the other governance aspect that support the delivery. So this is a critical piece that often seems to be left out when we are responding to health and nutrition, or talking about health system strengthening within the context of fragile and conflict affected countries. The other bit is a common understanding of what we mean by health system strengthening and the approaches that we think are most effective in strengthening health systems in fragile and conflict affected countries, so that we can maximize on the benefits of the resources that are being put in and are building on the outcomes of each and every intervention that is implemented in that context. It goes without saying that better coordination between donors and UN is critical. And then for many of these countries being, protracted crisis, it's important to look at partnership between humanitarian donors and development donors, because some of the solutions will not come from, humanitarian funding instruments or mechanisms. So having that partnership becomes very critical. And then obviously increasing investment in, health system strengthening. It's a bit disappointing and concerning to see a reduction in the funding for the health sector over the last few years. I mean, even when we look at the Horn of Africa crisis and you look at the appeals in different countries, you can see the stark difference between funding for some sectors compared to others. And we've just we've been talking about the importance of integration. So if I take, for instance, Somalia, we saw great level of funding, and great level here with asterisks, great level of funding on the nutrition sector, but poor level of funding on health. And you cannot do nutrition without the requisite or equivalent funding for health services. So looking at the system in totality and providing the required funding for all the pieces and elements in there. I think I'll leave it to the others to contribute.
Thanks, Amina. Christian, anything to add from a UN perspective?
Well, just coming to that last point about health sector financing in fragile settings reducing and nutrition financing being relatively better. So what we try to do is to use that nutrition financing, as we also did with the PP, to strengthen the health system. So if we look at creating community-based systems and making them function and making them a national policy, if we look at strengthening the supply chain, we look at support for human resources. We try to also take a perspective that how do you also strengthen those aspects across the health system. We know that nutrition wasting has many drivers, and many of those lie in health-related issues. So if there's no medicine, we will also not be able to prevent and treat wasting well. So we try to take advantage of where there is funding and use it also to strengthen systems, as was the objective of the PPP, but doing that more broadly. And I think UNICEF, the UN, can really act as a broker to bring the learning about strengthening systems at a subnational level, the excellent resources and tools that have been created to make that, to bring that to the national level and make it also reach all the other parts of the country. So having, taking the best practices, the most feasible solutions that are also affordable, are possible, taking them to the national level, creating standards also that all implementing partners, where we work mostly with partners like South Sudan and Somalia, implement some of these best practices across all of the programs, giving standard guidelines to all partners. So those are a couple of reflections on what Amina has said.
Thank you so much. And Sophie, any you've heard this, and do you have any last thoughts?
Thank you. No, I mean, I completely concur. I think, well, I'm a nutrition expert, right? So of course, I'm looking much more exclusively at that sector, but I think what we have tried to do indeed with ERNE and with the UNICEF PP is to indeed use nutrition as a way to have some multi-sector type of intervention and see whether we can indeed, act on the prevention of undernutrition, if we can, have early action that could prevent some peaks, some preparedness for the health system to be more resilient. And indeed, I think to your point, Amina, on how can we indeed try to work at different level, I think UNICEF for that is really, really well placed indeed to look not only at, local level, how can we organize, for instance, the supply chain, but also how can we strengthen a little bit the capacity at national level and build that up. It's not an easy task, but voilà, if we can indeed try to see if we can strengthen that, that could be very, very going a long way. Yeah, so I think we have to continue. I think we are trying also at ECHO to identify some good ideas and try to identify best practices and hopefully when there are some positive learnings to scale them up. It's exactly to the point that Chris was mentioning before. So yeah, I think let's try to keep doing that, and let's try indeed to influence other donors and long-term development actors in that as well by giving them some solutions on problems that are of course quite big to tackle.
Thank you so much. Thank you to all the panelists. You stay with us because we're now going to go to the floor and see if there are any questions from there. And looking at the chat, we have one from Kuwesi Alex. You've heard enough from me, so maybe Kuwesi, if it's possible, you could turn on your camera and read your question for the panel, and perhaps direct it to one of the panelists if you'd like to.
Thank you. My name is Alex Kuwesi. I think I'm directing it to UNICEF. I really like the conversation from Concern, UNICEF, and EU. And I'm concerned in a sense that with the UNICEF flexibility as from the PPP, which is a very good thing, I have a concern in relation to South Sudan. I know there's an engagement for 2023-2025 with the partners, but I wondered if there's flexibility to really pay good attention to the aspects of prevention, because again, in South Sudan, you find counties which are having very high prevalence and those that are having low because the practices have improved. Is there flexibility to really pay attention to these possible measures to maintain the gains while continuing with the life saving, but also dealing with the gains of the previous work in terms of resilience and making sure that we are able to prevent additional cases of malnutrition? Thank you.
Thanks, Christian. I think that was to you predominantly.
Yes, and I think maybe Sophie will chip in as well on the prevention and resilience financing aspect. We've certainly noticed, and very starkly, in the recent Horn of Africa drought crisis, and it applies to all funding, emergency appeals, and we were very grateful and appreciative that the nutrition part of our emergency appeal was funded to a very high level, but the resilience appeal was only about 10% funded. And the funding for the emergency came late after things had deteriorated already a lot. And we really now notice as we reflect, all our country directors, some of them new to the region, are like, we are just a big treatment machine. Where's the prevention? And I visited South Sudan a couple of months ago, and we're really focusing with the team on, in each different context of the country, what could we do better for prevention? Because what we often call prevention in the health system involves promoting practices, counseling, messaging, maybe some micronutrients. But that isn't, for me, fit for purpose in the face of the kinds of food insecurity and polycrisis that we've seen. We need better food-based approaches, including supplements, but local solutions in particular, to make nutrient-dense foods, protein sources, animal source foods available for children and pregnant and breastfeeding women. And we need expanded and better social protection systems that increases the household's ability to buy food where markets function, but also to buy an egg or buy peanuts or buy nutrient-dense foods, and not just a bag of maize. And to really link the cash, the food, and the counseling, cash, counseling, and I say chickens, cash, counseling, and chickens. We need all three to have effective prevention. And there's a strong demand for local solutions. But it's not a zero-sum game. We need to also treat children when the prevention falls short.
Thanks. Sophie, would you like to add to that?
Yeah, no, I think that you might be referring to the EU indeed funding, which is, I would say, a broader funding to the health sector in South Sudan, which is not, it's not ECHO. So it's a different stream, and indeed, I think it's really looking at the health sector specifically. So in that sense, yeah, it's not exactly the right, I would say, funding tool for the prevention part. As far as we are concerned, I think we see that. I think there is a lot of gaps, of course, in South Sudan. I mean, from the health perspective, but also as mentioned on the food and on access to clean water, etc., etc. So yeah, we are also trying to tackle that through our response. As ECHO, as a humanitarian donor, the response we have is much more local. It's not so much at system level. There is, again, this PP with UNICEF that was looking at the delivery of nutrition supplies, support to operations from the partners, and also looking at, for instance, the detection and treatment of malaria, because we know that often, as we know, we don't still have a very good, it's going to change in the coming years, but a very good, I would say, co-location between the nutrition and the health services, and malaria being one of the big issue we see in South Sudan. But we thought it would be at least maybe an easy one to tackle through this PP. But no, we definitely hear you. After we all have our mandate and our sphere of specificities, and it's true, ECHO is much more geared toward, of course, life-saving responses than prevention. But yeah, we are was considering everything that is relevant and that is feasible on our side too. Thank you.
Excellent, thank you. I think in the interest of time, we're going to the next question. This one's in French, and is one of the famous Gillian McCarthy's, so I'm not quite sure who's asked it. But I think what it's saying is that there's a multi-sector approach to health and nutrition has been successful. But the multi-sector approach to early warning systems has been met with some challenges. And maybe what do we, if anything, I mean, Sophie, you can correct all this, so forgive my translation. But why is that, and what are those challenges, and what are the implications, institutional implications for the multi-sectoral early warning? Is that the question, Sophie? And you can help me here.
I think it was indeed, why do we think that the health and nutrition part of the surge was a success, while the early warning component was not as much of a success?
Let's get Julie. I think
Julie, maybe I can clarify also, because the question comes from me, in fact.
Oh, wonderful.
If we looked at the ERNE program, there are many components of the ERNE programs that have been implemented. Regarding the search approach, the CMAM search and the health search approach, we know that this one has been a success, and it has been implemented in a huge number of health centers. There have been many capitalization exercises on this approach, and even a task force that was created to discuss in details the approach and then see the challenges and how to overcome and try the advocacy part until the strategy has been, let's say, appropriated at the national level, like in Niger, for example, where the Ministry of Health has integrated it into the national protocol. So, but regarding the other component of the early warning and response to multiple early action response to multiple shocks, what we observe is that this component has not been that achieved that great success as the CMAM and health search one. And today we can say that in Niger, for example, it has not been institutionalized. Let's say with the national early warning system, and also regarding the early action with all national components that were available at the country level to ensure a rapid response. So why that situation, and what has been the challenges, and how to how do you think we can overcome that situation? Thank you.
Great, and I'm going to open, I know none of you cover Niger in particular, but two questions. First of all, would the person who asked the question just tell us who they are, just for the sake to help illustrate the question? Who are you and who do you work for? Monsieur. You're on mute. If you could just tell us your name and who you work for.
Yes, my name is Amadou Alzuma. I am program officer based for ECHO based in Niamey.
Wonderful, thanks Amadou, that's fantastic. Anybody, I'll open it to anybody in the floor who would like to comment or respond to Amadou's point. Sophie, go ahead.
I can give it a shot. No, I think the early warning part is newer than, I mean, it's a new kid on the block, while the surge has been implemented, I think, in Niger since like what, 2016 or something like that. So I think there was much more already experience and than for the early warning part. And then I think it would be interesting to see the colleagues also coming in there. But is it even realistic? I mean, now I think we can really wonder with all this experience. Early warning, to be effective, we really need to target exactly the sectors that will have an impact on the incidence of undernutrition, and to make sure that we are really filling the needs, meeting the needs of all this population and the most affected ones. And I think it's a very, very ambitious agenda. I think we have to wonder ourselves, okay, you know what, how are we going to learn from that? What is the next step, specifically because there are so many sectors and so many variables, and the contexts are changing constantly. So yeah, I think that was a very, very ambitious agenda to start with, but definitely we have learned a lot. And I think what Jackie shared earlier with us was already very interesting. Over to you, maybe, Jackie.
And maybe just to add, I think as Sophie mentioned, this is a new component that has been introduced in some of the countries, except I think for Ethiopia, where they were advanced and had an early warning system in place already. But one of the learnings for concern has been that the early action component of that, the early action aspect of that component was very much focused on external actions, meaning concern coming in with a cash response or whatever response that was deemed appropriate at that point, and never really looked at, communities themselves taking certain action as part of, that early action and early response component. So that ownership was to some extent missing in some of the contexts.
Thank you very much. That stimulated a lot of discussion. I see Jackie's put her video on. Jackie, did you want to say something? If you do, please keep it very quick, otherwise we'll fall behind time.
Just to maybe add to this, the question that's been raised about the early warning system, especially in Niger. Having worked in the 5 countries, what we've realized as a team is that Niger has one of the oldest early warning systems in sub-Saharan Africa. However, the information collection system and then the department that triggers food security responses are very disconnected. And our efforts over the last few years to help them trigger responses that go beyond the annual lean season and have a very top-down approach towards it, haven't been as successful as needed. We were much more successful in other countries that have less robust learning, early warning systems. And we do have an early warning learning paper on the Niger experience that we can share with you that we wrote with the Red Cross Climate Center.
Thank you so much. Now, as always, people are warming up with a question.
Nigel, we're missing you. You're frozen for some reason. I'm just hoping you'll come back. Now,
Can you hear?
Yes.
Sorry about that. Don't know what. Our connection is unstable. So what I'm going to say is we're running out of time. Fiona has an excellent question. I think you can all see it. And I'm going to ask Christiane and Sophie to answer that in really just 30 seconds. Whilst Amina, if you could, while they're doing that, could you think of the yes/no answer almost to Regina's question above and just give us a yes/no for that when Christiane and Sophie have done their 30 seconds each on South Sudan. Sudan, sorry.
Sudan.
Yeah, Christiane.
I don't actually cover Sudan, so I don't know if Sophie or others may have a broader perspective on that very specific question.
Sophie,
Actually,
pressure on you.
No, not really. I think, I think it's been a challenge to work in Sudan because of, so many reasons. I think the structure of the system itself, the fact that there were so many restrictions for implementing partners also to intervene, and it's extremely difficult to influence also and to change the policy and the what is in place there. So I don't think also I would be very good to provide an insight on the reason why it reached this level. But I think certainly the difficulties of operation certainly didn't help. Sorry, it's not very satisfactory. Thanks.
I think what's happening is extraordinarily awful, isn't it? Extraordinary and extraordinarily awful to the health systems in Sudan. So, Amina, will you go back to see the impact of your work after the program has ended?
The answer to that is yes. We have follow-on funding for some of the countries, and for others, we have complementary funding that will allow us to continue monitoring the progress.
Excellent. Thank you so much. And thank you for all the questions. They really stimulated an excellent conversation. The wonderful thing about having a panel is you can use and abuse them for as long as you can. And I'm going to ask the panel to further commit. And in the last session of this particular session, I'm going to ask each of you, what is the one key takeaway message you want to highlight on how the humanitarian community can adapt and strengthen emergency health and nutrition programs? What's your one thing? If you could do just one thing to strengthen them, what would it be? And what is the one key commitment you can make to support that, either as an individual or by galvanizing your organization? And I'm going to go in reverse order this time. So Sophie, yours to start with.
Lucky me. No, I think to definitely stop looking at a sector once at a time, and to look into multi-sector approach. And I think specifically for nutrition, at health, at WASH, and as was mentioned in one of the discussion group, potentially also protection. I think this is really one way to go and to increase the efficiency of our response, and to increase the impact we can have towards affected populations. And I think there is a lot of learning. The discussion of today were extremely rich, and we see also that every country have their own learning, their own capacity, their own challenges. So I think we have to capitalize definitely a lot on that. In terms of commitment, I think ECHO, we remain really committed into, of course, respond to humanitarian crisis, to nutrition crisis in particular. We also remain very eager to support new initiative, and to see whether there is opportunities to bring them at scale, because we see that the way we are working at the moment, we won't be able to respond to the magnitude of needs that we have ahead of us. So yes, remain flexible, remain our eyes open onto new solutions. Thank you.
Thank you, Sophie. Christiane.
Okay, so from the takeaway, and Sophie said one of the takeaways about the multi-sectorality, so I'll highlight another one. I think we need to do better in terms of the humanitarian and development, UN donors, NGOs, national, to make sure that the best practices and learnings get taken to scale, and to broker that. And I think to do that, we do need that sort of more nexus type of funding that is longer, more predictable, more flexible. So that would be just from listening to the really excellent presentations and learnings from the ERNE project. And I see it all the time, a really good initiative and innovation here. How do we bring them to scale and make them part of the DNA of doing business? In terms of commitments, so at the global level, we have, I don't know if you can see it, the No Time to Waste Acceleration Plan, our global plan to for the prevention, early detection and treatment of wasting, in progressing from 15 to 25 of the most fragile countries, and continuing as nutrition advisor to work with my colleagues in partnerships to mobilize more funding. We've already reached about half of the first year goal. It'll take a lot of money. The first year goal was 1.2 billion. And we need to continue to mobilize more partners to achieve the goals in this No Time to Waste acceleration plan. And then coming to ISARO, our commitment in terms of our collaboration for children, as we call it in nutrition, is to continue strengthening the health systems for nutrition, including particularly national financing, supply systems, etc., strengthening the social protection nutrition linkages, and improving foods for children. So prevention and keep maintaining the momentum to treat all those children for whom prevention falls short.
Thanks, Chris. Amina.
So I think I agree with what Christiane and Sophie have said about multi-sector, multi-actor response. But I think what I want to add as part of a takeaway from today's session is the importance of having a resilience health system. And that requires a shock responsive system. And so strengthening the shock responsiveness element of the multi-sector, multi-actor actions is critical in the context of the countries we're talking about. And this will require long-term and flexible funding to achieve that. In terms of commitment, Concern commits to continue working on an integrated approach to addressing malnutrition, as well as, and this is specific to the Horn of Africa region, strengthening our health capacity further. I mean, there have been lessons from ERNE on what we need to do, and the commitment is there organizationally to strengthen that further. Thank you.
Thank you, and huge thanks to all three panelists and to those who put in questions. What a wonderful discussion to end a really great day of debate and information sharing and learning. Really hard to summarize all that we've heard, but lots of takeaways around the evidence that's come out of the PPP and the ERNE program in particular, but also how the evidence can be taken up into best practice at national level and how it can inform standards and policies. And those standards and those policies and the practice that come out of the envelope that I take away from your takeaways and your commitments, I mean, fairly consistently about the multi-sector strengthening is coming out loud and clear, as is the need for predictable multi-annual funding in order to do that well. And the importance of the focus on fragile countries and the shocks and the need for resilience for the health systems and for the people, of course, in order to cope with those shocks and to ensure that nutrition work and child survival work can continue even when these fragile states are affected by the awful conditions that they're presented with today. So that ends this session. Again, a million thanks to all of you three. Fantastic discussion, and I hand back to Connell.
Thank you.
Thank you very much, Nigel, and thanks Amina, Christiane, and Sophie also. That was excellent. So I'm left with the rather unenviable task of trying to summarize the whole day. So thanks, Nigel, for trying to make my life a bit easier. So I won't keep you long. I'm a slow thinker, so digesting it is difficult enough. I suppose the purpose of today was really about presenting our findings, our results, and our learning. And really, we had three overall aims. One was to share, discuss, and refine our learning. The second was to develop recommendations on how to adapt and strengthen health and nutrition responses. And the third one really, I suppose, was more to take both of those and put them into our outcomes report post-event. So again, it was really great to have the presentation from Aoife about the results and the outputs and the results from the programme. I think we in Concern, it started quite slowly, had its teething problems, but then obviously that was during COVID, as pointed out. So a classic shock thrown into the equation early on. But I think we picked up speed and it was actually fantastic. And I would like to thank the whole team, all of you who worked on it. And I know a lot of you are online from the different countries. And to actually achieve what you did achieve was fantastic within the context. And I said, catching up post-COVID, during and post-COVID. So well done on that. When you go back to the program itself and the purpose of it, the three pillars, the first one was around life-saving responses, I suppose very much around CMAM and cash. The second pillar was very much about building health service capacity to respond, so much more on preparedness and looking at innovations, piloting shock responsive components. So we're getting into the early warning, early action, and obviously CMAM surge. And then the third pillar, which I feel was a little bit underrepresented today, was the preventing, I suppose, malnutrition, or I suppose addressing causes of it. So through feeding and hygiene practices, infant, young child feeding, etc. And I'll come back to that at the end. What I heard though today was, again, very much reflects the nature of the participants as practitioners. And I think that's the value of these kinds of learning events, that you're all practitioners, you're getting into the weeds and the details, and you're sharing your lessons from those details in your particular context. And I think that's really quite powerful. I always feel that we do need to work from the detail up and not from broad policies down. The group work was interesting. I mean, I think, let me just very, very quickly allude to the stuff that I picked up from the group, the three groups. On access, I mean, I think that the key messages jumping out were those that are probably fairly broad, not just around access, but promoting integration at a range of levels. So obviously integrating nutrition within health, but also integrating things like needs assessments, protocols, and funding streams. And obviously we'll come back to some of that at the end. From the access group, they also talked about recommendations for implementers. And I thought there was a very interesting one there about keeping things simple as implementers, as in, and I think Jackie probably referred to this in terms of the early warning systems, is, you know, not to overcomplicate things at community level, to try and make them as practical and understandable at that level as possible. And again, we'll come back to that. But what I did like again was that, you know, as NGOs, I think we have to remember that we're not just providing technical inputs. We are actually, once you are supporting health system strengthening, you're actually getting into issues of management and system strengthening, outreach. It is all about management capacities at the end of the day. And I think somebody made the really important point, I think it was Amina, how that we, as international NGOs, we can do that at a district sort of level, like at lower levels of governance, but we do rely on both donors and on the UN agencies to be doing that at national level. And we know it's a difficult task, but ultimately, if you don't have your health system workforce supported from the national level, then you're always playing a catch-up game. So again, I think this idea of keeping the focus on the health system and the health system strengthening, and then using mobile services only in exceptional circumstances. So again, this links to the early warning, early action, the way that we do CMAM surge. So we're obviously identifying where spikes in diseases, including malnutrition, are happening and trying to then scale up CMAM outreach, but also mobile services. But then it's really important that we scale them back down and we don't just rely on those all of the time, but we go back to long-term health system strengthening as much as we can. That came out very clearly, I think. Yeah, on the supply chain side, we had an interesting comment. I was in that small group, and no easy answers to that, I would say. I think we know that there are a wide array of reasons for pipeline breakages. You know, it's all sorts of things, and I think we focused on, I think, monitoring, particularly monitoring at the health facility level of, you know, the needs at that level. Also things like transportation, they were the kind of things we focused on, but obviously there are a lot of other things in there in the background, like corruption, et cetera, that we didn't even talk about. But again, I think what we really liked was we were circling back to say, you know, that it was important for people like UNICEF and WFP to be working together, because they obviously have both quite separate pipelines. And it's back to the integration again. It would be fantastic to have one pipeline running through the health system if possible. We know there are lots of political reasons for that not to happen, but I thought it was great that Gwen from ECHO gave us a really nice practical example from Kenya of where actually UNICEF, the Ministry of Health, and WFP are working together, monitoring supply or needs at health facilities level through SMS. So using something as simple as SMS in a very practical way to get real-time data, which is really what we need. We don't need, you know, elaborate systems sometimes have big lag times built into them. So I really think that they're the kinds of things we need to be looking at, those practical systems that we could scale up and use. Then we went into the system on early warning, early action, and I thought it was really, really, really important and critical area to look at. I mean, really, let's be honest, we're focused here on fragile and conflict-affected contexts. So if we're not looking at shocks, if we're not analyzing risks on an ongoing basis, really, we're wasting our time. So I thought it was very interesting the way that we presented the cogs about information coordination and common objectives. And I think it's obvious that information exchange is the easiest. Coordination is always a challenge. I mean, it's interesting, the whole cluster system was set up to address so many evaluations that came in with the weaknesses of coordination and humanitarian action. But, you know, I'm actually the co-chair of the Executive Committee of Scaling Up Nutrition. And obviously coordination, I mean, this whole multi-sectoral, multi-stakeholder approach is absolutely central to good nutrition, not just on the obviously wasting side, but probably even more so on the stunting side of us both. And having common objectives is critical. It sounds simple, but obviously the devil is in the detail. I mean, information management systems become very central to that, and it was great to hear a sense of realism in relation to those. It was great to hear some good examples from some of the countries. I think Ethiopia, South Sudan, Niger. But I think it's really important to have that sense of realism. And I thought it was really good that Jackie mentioned that when we talked about the what's it called? I always mix it up. It's the risk at the multi-hazard risk matrix. That's the one, the multi-hazard risk assessment. That it does kind of work a bit outside the way individual ministries work. They have their own systems, and sometimes it's quite hard to break those. So again, we're back to this idea of integration. But you know, if we're trying to be as local as possible, having an overly complex community level or local level multi-hazard risk assessment becomes quite difficult. So again, it's back to trying to make that simple yet capturing the roughly the right kinds of things. That becomes quite important. I thought it was really good. Their key recommendations coming out of that was the importance of coordination of analysis, or back into integration. And again, if you're talking about things like the nexus approach, then, you know, at the heart of that is the coordination of analysis, shared analysis across agencies, so that we're actually all working off the same data and working to the same ends. And I really like this idea of localized early action plans. And we all know that there have been early warning systems in place for quite a time in different countries, but they just don't sometimes trigger early action. And to do that locally, I think is really powerful and what needs to happen. One of the things a couple of maybe final points to make in relation to that is, I think it's such a struggle to build strong health systems in contexts where governance is weak and they're conflict affected. And I think we're seeing that in Sudan at the moment. So I think this idea, and I think it was Christiane who mentioned it, and a number of people probably mentioned it, is how to kind of almost work from the bottom up as well. So that idea of community system strengthening and really trying to use that as a good base, and then working off the top of that, I think is really important. So it links in very much with localized early plans. My takeaway from the, I think the group discussions was, and I think my takeaway from the whole day in some ways, was to say, look, a lot of these are complex and embedded problems. You know, they're not easy to solve. For many of us of a slightly older age, like myself, we've been grappling with these issues for decades, and they're not easy to resolve. And I think really what I like, what I hear about the spirit of today and this whole learning approach is that we need to focus on finding very practical solutions at the levels at which we work. So for those of you in country, you know, working at local level, trying to find practical solutions there. And for us who work at more middle level, finding practical solutions around coordination, collaboration with other agencies, for example, even breaking down our own silos within our own organizations, which comes across in all of the Nexus literature. You know, try to find our own solutions and then use them as a basis for advocacy. I really think that's what we need to be doing. You know, I feel as Director of Advocacy and Concern as well, that we often say exactly the same things to the same people the whole time. We want more money. We want more multi-annual, multi-sectoral funding. Of course we do. I think everybody knows that. I think, and I'm sure Sophie from an ECHO point of view will explain and understand all of the bureaucratic impediments to that and the nature of the multi-financial framework at the EU level, et cetera, et cetera. So again, I think it's around trying to be clever with our advocacy and be sharper about proposing very practical solutions and getting those taken up and scaled. And I think that came very much through in the panel, which was really good. Just on the panel, what I heard was a violent agreement in the panel. I hope the three panelists don't mind me saying that, but you all seem to be on the same page. And you were all very much in line, I think, with the recommendations that Aoife and our team have put together in our learning paper, the overall stakeholder recommendations. I think we're all saying pretty much the same things. I do think it's about consistent engagement and support. I think that whole point that you can't do that on very short-term humanitarian funding is really important. And I think, you know, most of us as practitioners understand that already. Effective coordination across the different parts of the Ministry of Health and also across sectors. I think I've also already referred to that. from my son, with my son hat on. The localized early warning, early action came through. I really liked the point, I think was it Amina who made it, about local thresholds, that sometimes, you know, you'll have these pockets of very high thresholds, high caseloads, but they would sometimes maybe get lost within a higher administrative analysis or information dump, whatever it is. I mean, that's something I think was a really interesting point. And again, this idea that we do need the donors and the UN agencies to support that governance at that national level. That's critical. And it kind of circled back, and I'm glad to hear a lot of people talking about the real need for partnership between humanitarian and development actors. And I suppose as the whole day went on, my concern a little bit was that I was hearing very little on prevention. And it was really good to hear that coming up in the panel, and some of the questions that came up as well. I think Kawisi was the one who brought it up, but you know, that we do need to look at prevention as well. So to me, that link, you know, to livelihoods, to dietary diversity, to social protection, to cash, they're all really important, and making sure that all of our programming is shock responsiveness and analyzing risk on an ongoing basis. That's really important. You know, to me, that links in a little bit with, I suppose, the Global Network Against Food Crisis. There's a coalition in the Food Systems Summit that is focusing on the triple nexus as well. So again, we should be trying to feed any learning and information to a number of those fora to try and influence a wider policy environment. The last thing just to say, I suppose, was, and it came out from IFA's findings from the ERNE one, I suppose, was just about behavior change and how hard it is. I mean, it was quite depressing, I suppose, that again, the knowledge around hygiene has gone up, but there actually hasn't been huge change in behavior change. But again, it goes back to a long-term engagement on behavior change and consistent engagement if you're really going to change behaviors. And again, the fact that trying to change many behaviors at the same time is very difficult. So, I mean, that's what I would take away. I'm sorry, it's a bit of a dump, but, you know, again, for me, what I heard today was very rich. So I said, thank you again to everybody who participated and provided your ideas. Very much in line with the kind of recommendations that came out of our learning paper. We will refine those, and to make sure that when we have a final outcome paper, that some of these ideas that you came up with today are very much factored into that. So just to say thank you to everybody who took part, and particularly just again to the ERNE team for all the work that they've done, and to Aoife and Gillian for organising this with Jackie and all of the other great ERNE staff who did it. Just to flag up that tomorrow afternoon on the 24th, between 2 and 3:30 UTC +1, you can work out the times yourselves, we do have a session on the way forward for the surge approach that CMAM and Health launch of revised guidelines, and Lucy and Mariama will lead on that tomorrow afternoon. So it's just my pleasure to thank you all for your participation. I hope you all enjoyed it, and I hope you found it useful. Thank you so much.